What tests confirm COPD and what do they mean? Imagine trying to breathe through a straw all day long. That's what living with chronic obstructive pulmonary disease can feel like. To confirm if you have this condition, doctors relying on a few key tests. The main one is called spirometry, a simple yet powerful lung function test. During spirometry, you take a deep breath and then blow out as hard and fast as you can into a device called a spirometer. This test measures how much air you can exhale after a deep breath, called forced vital capacity, and how much air you can force out in the first second, known as forced expiratory volume in 1 second. The ratio of these two numbers tells the doctor if your airflow is limited, which is a hallmark of COPD. If your forced expiratory volume in 1 second is lower than expected and the ratio drops below a certain level, it indicates airflow obstruction. Sometimes the doctor will give you a bronchodilator, medication that opens your airways, and repeat the test. If your lung function improves significantly, it might suggest asthma rather than COPD. Besides spirometry, imaging tests like chest X-rays are used. They help rule out other lung problems and can show signs of emphysema or hyperinflation, which are common in COPD. A more detailed scan, called a computed tomography scan, provides clearer images and can identify the type of COPD you have, such as emphysema or chronic bronchitis. Blood tests are also helpful. An arterial blood gas test measures oxygen and carbon dioxide levels in your blood, showing how well your lungs are oxygenating your blood and removing carbon dioxide. This helps determine if you need oxygen therapy. There's also a blood test for alpha-1 antitrypsin deficiency, a genetic condition that can cause early lung damage. If you have this deficiency, your doctor might suggest specific treatments. Lung volume tests measure how much air your lungs can hold, including the air left after exhaling. This adds more detail about your lung capacity. Lastly, a 6-minute walk test checks how far you can walk in 6 minutes and how well your oxygen levels hold up during activity. This test shows how COPD affects your daily life. Taken together, these tests give a complete picture of your lung health, helping your doctor confirm the diagnosis, determine the severity, and plan the best treatment for you. Remember, spirometry is the main test used to confirm COPD, but these additional tests help paint a full picture of your lung condition.